On this episode of Newt's World, the government shutdown looms over Washington, and people wonder if Congress will ever come to an agreement to reopen the government. Here to talk about the government shutdown and the current economic forecast, I'm really pleased to welcome my guest, Dr. Vance Ginn. He is the former chief economist for the Office of Management and Budget, the founder and president of Ginn Economic Consulting, and the host of Let People Prosper podcast. Vance, welcome and thank you for joining me again on Newt's World.
Speaker Gingrich, it's always a pleasure to be with you and all of the work that you've done. Thank you for showing the guiding light of where we should be heading instead of the fiasco we have in D.C. today.
You just know so much. I was really looking forward to this because there's so many different things going on. And given that you served as the first President Trump's White House director of the Office of Management and Budget from June 2019 to May 2020, you really have an overview. I think for most people that really understand OMB. Could you talk a little bit about what it was like and what it was like to be the director?
So I was actually the chief economist. Russ Vought was my boss. He was the acting director at the time. So I was the chief economist directly under him. But I was one of 7 in leadership of a 535-person agency at that time. I think there's been some furloughs since then. But OMB is fascinating. I mean, it really controls a lot of where the money is flowing. Congress passes it, as you know, from the budgets you passed back in the day. And then the OMB gets that money, and then they distribute it out to all the executive agencies where things happen. There's associate directors for healthcare, for education, for different ones that really oversee that money. And so OMB really has a step right there at the White House and the Eisenhower Executive Office building. I remember where I would go into the Navy mess anytime I wanted to and see all these people and talk to people and really gain knowledge and insight from them along the way. But you're right. OMB has a huge influence on the budget process. And right now with Russ Vought there again, he's a big fiscal hawk. I think he's doing a lot of the right things that are there. We need to understand not only what OMB does, but how much that Congress also needs to start doing their job as well.
You've known Russ. The fact is he's at a central role right now in this shutdown and in trying to get back to a balanced budget. What was your sense of him as a boss?
Well, I mean, look, his key thing was at that time was let's find savings wherever we can. Let's dig out the waste, fraud, and abuse. There was a big focus on discretionary spending, which, is maybe a quarter of the budget. But his point was if we can't get our own fiscal house in order on discretionary things, how can we go ask the elderly or the older age or who are on Social Security to have reforms for Social Security or Medicare? And so I think there were some good points there that was made. And so he had a steadfast vision of reducing the size and scope of government. And that was something that I totally agreed with and something that we kept pushing for each day while I was there from June 2019 to May of 2020.
Given that you have an insider's view, from your perspective, how effective has the Department of Government Efficiency, so-called DOGE, been so far? And do you think it's achieving the goal of cutting waste?
It's a great question, Speaker. And I think whenever I'm looking back at it, we got to think about, okay, whenever they went in, Elon Musk and others, they said, we're going to find $2 trillion in savings. I think that was kind of a pipe dream, but it's nice to have a North Star of where you want to be at some point. I think at the end of the day, Congress, they rescinded about $10 billion worth of money. So that's good. That's a good start. But there was also a lot of contracts that were cut and saying, look, why are we spending money on all this ridiculous stuff? And those contracts, as you know, were out in the future. So I think we're not only seeing maybe some smaller amount of savings today, but the savings will also go out in the future. And I'm not sure exactly what those amounts are now, but at least we're starting to look at the fraud, waste, and abuse that's within government because it's large. I mean, I've done some work on healthcare, for example. I have a new book called Empower Patients with Dr. Dean Waldman, where we go through healthcare and everything else. And we spend across the country $5 trillion on healthcare every year. And from our estimates and looking at other research, about half of that goes to bureaucracy and regulation and paperwork. It doesn't go to patient care. And so if that's half in healthcare, just imagine what it is across many other areas of our economy.
When you think about it, my dad was a career soldier. And I remember in the late 50s, under Eisenhower, they had a reduction in force. And we had actually some officers who were reduced to being sergeants, but stayed in because they wanted their pension. So when I see about reduction in force, I don't see that as a gigantic thing, but it seems to have shocked the Washington establishment that the Trump administration is actually reducing people permanently as part of the shutdown. What's your reaction to that strategy?
I think it's important. I mean, if you think about one of the main cost drivers of just the federal government itself, of the operations, the labor, the workers, that's a huge cost. And of course, they get pretty large pension funds and everything else that are tied to that. And so that increases the cost. So one way to reduce the cost is reducing the number of workers. At the same time, going back to Elon Musk, I mean, look, whenever he took over Twitter, and I know Twitter is X now, and it's not the federal government or anything like that, but he cut the workforce substantially, I think by 80%, and they still found ways to improve. I mean, X is probably better than it ever was today. What if we could do something similar to the federal government? You're always going to have some cogs in the wheel, if you will, of moving paperwork around and making sure the regulations are checked and stuff like that. But in a period of time when we have a lot more technology and AI and other things that are going on, I think there's a great way to improve some efficiencies. If we can, it's difficult in the federal government to get efficiencies, but I think this is one way to do it. I'm glad that they're looking at how many employees are in certain areas of government and looking at those contracts and figuring out how can we get more money back into the private sector, because with us running $2 trillion a year in deficits. Last year was $1.8 trillion and $37 trillion in national debt, $1 trillion plus in just net interest payments on the debt. We've got to start cutting somewhere. And so whether it be from what DOGE is doing on contracts and other cuts versus during the shutdown, permanent layoffs at the federal government. I don't know how many of these at the end of the day, Speaker, will be permanent compared to furloughs that they'll pay him back. But it does look like Russ Vought and others that are there are really trying to find ways to cut the government permanently.
Eisenhower was very tough on spending. He would have agreed with Treasury Secretary Besant's recent comment that the problem is not revenue, the problem is spending. And I know you've said something very similar, that we must be clear that the shutdown is just a symptom. The disease is runaway government spending. How do we get across to the average American the time bomb that is building in the scale of the federal debt and the amount we're now paying in interest on that debt? I mean, how can we communicate that?
Well, I think in some sense, the federal government's doing it for us, Speaker. I mean, if you look at the inflation that we had during the Biden years, people saw that measurably in their own life. And saw that they couldn't put food on the table. They couldn't make ends meet every month, and they had to get multiple jobs and all the things that created. And while, in my view, government spending doesn't create inflation, what it does do is when you run deficits, the Federal Reserve, interest rates would go up. Well, the Federal Reserve doesn't want interest rates to go up. So they come in and buy the debt, they print money, and that money printing creates the inflation that's around us, which is a direct result of the overspending of Congress. What I've been trying to do when I'm talking to college students and others across the country is to say, look, we saw the direct effects from this inflation that was out there. Yes, interest rates are up higher than they were back then as well. But if you just look at the cost of everything that's going around you, this was a direct result of the overspending by Congress and the Fed printing too much money. And I think if we could start getting those things tied together, which they should be, then we have a better presentation of the cost of overspending by government.
One of the areas I've been fascinated by is the degree to which the Dodd-Frank Act was, in fact, a bad idea, and that some of the things it created are, I think, disastrous. And when Obama signed the Consumer Protection Act into law and created this totally independent agency, I think one of the very few places in the government where they can generate their own money, and they've grown to be huge in terms of number of people they employ. Talk a little bit about why the CFPB, the Consumer Finance Protection Bureau, why is it a bad idea, and what do we need to do about it?
I think you don't have to look too far, Speaker. I mean, we had Elizabeth Warren. She was the first director of the CFPB back in the day, and we know how socialist she is. Why do we need the government protecting consumers? Consumers are best protected by the marketplace of whether or not they want to buy something or not. And that allows for voluntary exchange to happen. We don't need a whole government agency. And the way that they're financed, right, is through the Federal Reserve. So the Federal Reserve is running net operating losses of over $200 billion a year right now, and yet they're still funding the CFP at the same time. What I've been trying to get across to my former boss, Russ Vought, that we were just talking about, is he's right now the acting director of the CFPB and the director of OMB. Why don't we find ways to continue to cut what they're doing? And they're doing all these bad rules as well related to the Dodd-Frank Act back in, was it 2009, during the Obama administration, is this Section 1033 rule, which is they're calling it the open banking rule, but really it's just forcing information from bigger banks to give to a lot of other banks. And I don't know about you, Speaker, but the first thing I learned in economics is nothing is free. Nothing is free out there. The government shouldn't be mandating these sort of things. And so this is just one area of the CFPB, the Section 1033 rule, and other things they're trying to do. We're just overstepping the bounds of a limited government form of the roles of limited government.
If you could, would you just abolish it?
I would. I think there's no reason for it. I mean, there's no constitutional direction. And, Speaker, I don't understand why we would create something that's funded by another independent agency. And they did that. They did it because they didn't want Congress to have to fund it, because they knew that there was a problem. I think that's another reason why it should go away.
Well, it strikes me, and I think this is where Republicans maybe aren't quite intellectual enough. There's a whole wave of Obama-Biden laws and Obama-Biden rules. That 12-year period between the 8 years of Obama and the 4 years of Biden, and the Biden administration was essentially just Obama carried forward in terms of staffing and attitude. But those 12 years were disastrous. I think whether it's in healthcare or, as you point out, in the Consumer Financial Protection Bureau or in a host of other places, we ought to be much clearer about how wrong these approaches are. I mean, the country instinctively opposes big government socialism and understands that it doesn't work. And I think that we can really profoundly change the system and have the country with us if they understand that it's principled and it's based on the failures of Obama and Biden.
Yeah. Great points there. And just to add to that, to kind of make it relevant to what's going on today with this federal government shutdown. And as we're recording this, I mean, it's been shut down now for a couple of weeks. And I think when you look at this, what is the real reason? Well, it's because Democrats want to add $1.5 trillion more dollars in spending. I mean, the Republicans came in and we could argue whether or not this was a good idea, Speaker, that they had a clean CR that was basically extending all of Biden's sort of spending to try to get a couple more months or some more time to talk about healthcare reforms and other things. And the Democrats wouldn't even agree to that. And this was Biden spending. What the Democrats are trying to do is to extend the emergency declarations during COVID of more people were not able to age out or income out off of Medicaid. They made it all these suspensions of these rules and everything else. And they want to keep those people on that are now making way more than what you should be eligible for to get on Medicaid. We're up to almost 20% of people on Medicaid when initially, whenever Medicaid was created, there was only about 5%. And so it's unfathomable to me that the Democrats would want to continue to push this. Well, I know why they want to do it, right, Speaker, is that they want universal health care. If the more people they get on the program, the more difficult it is to get them off. And that's why this kind of fight is going on. And I don't know when the Democrats, or I guess they're going to give in at some point to get the government open again, because at the same time, we've got to look at the overall spending. And I think that's where healthcare is a great way to do it. And we don't need money going to illegal aliens, just like we don't need it to go to Americans who have higher incomes and have aged out of the program.
You wrote, I thought it was very powerful, that the U.S. healthcare system is failing Americans because it rewards bureaucracy, not care. What do you mean by that? And how did the system become so misaligned?
In our latest book on Empower Patients with Dr. Dean Waldman, and then I have a paper also at Americans for Tax Reform, where I'm a staff economist there, Empower Patients Initiative. We talk a lot about how the root cause of the healthcare crisis in America is government. It's a third-party payer system, right? Whether it be Medicare, Medicaid, or other sort of government programs. Also, private health insurance is a third-party payer. And I don't have necessarily anything wrong with them, but we've been forced into private health insurance because of government decree back in the World War II wage and price controls, whenever there was no way to give out additional wages. So employers started providing employer-sponsored health insurance. And then there was a tax break for it. And so that's crept into the system at us not paying the amount of money that we ordinarily would for healthcare. And I think we would actually pay much less if government wasn't forcing us into this situation. So all that regulation, red tape, unnecessary rules of pushing us more and more into healthcare through our employer and on all these government spending programs, because about 60 cents of every dollar from our research in healthcare is spent by government, meaning us, the taxpayer. It's a redistribution sort of project they have going on. And so when you look at all those costs, you get about 50% of the $5 trillion we spend. So let's say $2.5 trillion is going to something that's not patient care. And I think you could increase patient care, or you could cut taxes and give more money back to people so they could take care of themselves. But I think this also is a big problem here. Another issue that I've been talking a lot about is a dependency crisis. I think we're in a dependency crisis, whether it be Medicaid and Democrats wanting to put more and more people on it, or other types of healthcare expenditures as well. There's just a lot of dependency on government, meaning someone else, the taxpayer, to pay for these things.
Yeah, for some reason, I think because they are big government socialists, Democrats prefer anything which takes away your individual strength and forces you to rely on government. It's amazing that their model is essentially a totally government-centric America, which would, of course, be radically different.
And Speaker, on that point, if I could, is I think oftentimes I'm a Christian and God is above government, but I think too often we get people like the Democrats who want to believe that government is God, the lowercase g, and they want government to do everything.
I think that's right. One of the things I'm working on now is that we have, with new technology and new science, we have an opportunity to help Americans who are challenged and to literally move from a focus on disabilities to a focus on capabilities, and in a sense liberate millions of people to have a much fuller life and a much more self-reliant life than we currently think about when we put them into sort of a disabilities category. And that's an example of the transition. We did this, as you know, when I was speaker, with moving from welfare to workfare, and the effect was enormous. I mean, the number of children who left poverty was the largest number in American history, and it was because their parents were going to work, which not only increased their revenue, but it had the good virtue that children were learning that on Monday it's okay to go to work and not just sit around and wait for somebody to send you a check. So we were changing the whole culture. The Democrats, to a surprising degree, just hated. They hated the idea of people being independent, which I thought was truly bizarre. But let me go to a totally different topic for a second, because you've written something I believe in strongly and would like to see the Trump administration pick up, and that is that we should index capital gains. Could you describe why you think that's important?
It's substantial. Right now, when you think about your stocks or your housing value, other things that you may be taxed on whenever you get those realized gains, that's based on capital gains taxes, things of that nature. But that's when you realize it, when you actually have the amount of money coming into your pocket, and then you can pay those taxes. That's one thing, because that's a source of income. However, what we've seen within the capital gains and within the stock market and things of that nature, just to use that as an example, is that over time, part of the gains are due to inflationary pressures across the economy, meaning the Federal Reserve printing money and things of that nature that are not real returns. In fact, it's taxing unrealized capital gains over time because of that amount of inflation that's happening. In other words, we are being taxed too much, and therefore disincentivizing the amount of savings and capital that can go into businesses. Because remember, more than half of Americans now have some form of money in stocks and savings through 401k and other things that are out there. I think it's closer to 60% nowadays, actually. And so it's not just the quote unquote rich, it's a broad swath of Americans across the country. And so indexing for capital gains is important to measure it on inflation. That way you can adjust for the nominal gains to real gains in economic terms, or in other words, on the things that you actually have money out for and have real gains over time. And so I think this is also huge for the economy. If there was not the inflation tax, if you will, on capital gains, there would be more money put into the stock market, more returns for those who are savers, and more returns for businesses that are receiving those funds. And so the economic gains are substantial. And so I think this is something that needs to be done. When I was at OMB in the first Trump administration, we looked at this quite a lot. We found at OMB that this was a step in the right direction. Unfortunately, some within the administration, mainly the Treasury, didn't agree with us. And so they pushed back and ultimately Mnuchin and others won that debate. But I think it is something that needs to be looked at. I would like to see Congress do it, Speaker. I think that would be the best way to do it. But I think there's also a path for Treasury Secretary Bessent and the Treasury to do this in the meantime until Congress can get something passed.
If you were looking at negotiating once the government shutdown is over, and I've been pretty clear that they have to reopen the government before we negotiate. And I think Trump's pretty clear on that, and certainly Mike Johnson and John Thune have been clear on it. So when they get around to negotiating, do you have a sort of scorecard for how you would approach what's a good Republican solution on where we are with particularly this whole COVID insurance subsidy, but also just in general? If you were going into that negotiation, what would you want to have as the things Republicans should insist on?
Starting off with the COVID era tax credits for Obamacare, I mean, all those should go away. To me, there's no need for it. Even the Biden administration ended the emergency declaration. And so we should go back to some sense of normal, going back to before the COVID era. I mean, I would love to see the budget go back to the 2019 levels. The last budget that I helped write for the president for fiscal year 2021, the budget was $4.6 trillion. And at the time, we still were like, this is too much. This is too much. And the latest numbers for fiscal year 2025 just came out, and it was $7 trillion. We're up to $7 trillion now. I know it's a Herculean effort, if you will, to go back to the 2019 levels, but we've got to think about cutting that at some point. And also at Americans for Tax Reform with Grover Norquist and all of them who are doing some great work, we've been working on sustainable budgeting, which means that if once we get back to a better level of government, which should be cut, but let's say we start where we're at today, we need to have some sort of growth limit, a spending limit. And we've argued that the maximum should be population growth plus inflation. And if you limited to population growth plus inflation, and we had 1 percentage point more in economic growth, we could balance the budget in 5 years. So just limiting the growth of spending and having more economic growth for more revenue would allow for us to balance the budget in 5 years. And so if I was in that room, I would be making the case that, look, we've got to get our fiscal house in order. Let's get rid of the COVID era tax credits. The emergency is over. Let's get out of that business. And then let's limit the growth of spending on population inflation as a maximum. And then also let's have more growth. Let's find ways to deregulate the economy as the Trump administration is starting to do. I would like to see us build on the One Big Beautiful Bill. They extended the Trump era tax cuts of the Tax Cuts and Jobs Act, and there were some other things in there. But I think there's still some key reforms that we could have that would allow for more economic growth, and getting government out of the way, whether it's in energy, healthcare, and other places, would allow more money in people's pockets. And that way we could see more economic growth and we can balance the budget in a faster time, period.
How strongly would you oppose a deal coming out of this shutdown? When they sit down and negotiate, how strongly would you oppose anything which increased the deficit?
I would be opposed to it and just in general, in principle, but I have to look at what the details are, right? What are we giving up in order to get? And, there's always trade-offs. Even in economics, Thomas Sowell said there are no solutions, only trade-offs. And you know this, Speaker, from going in those back rooms, that there's always trade-offs that are going on. And so I would try to be a hardliner. I believe myself as a fiscal hawk. And so I would try to keep pushing us not to get to a place where we're increasing deficits. But if there is some sense of pro-growth policies that are in there that on a static basis would increase the deficit a little bit, but on a pro-growth policy or a dynamic scoring would balance the budget or bring down the deficits, that's something that I think we should look at on these negotiations.
How big a challenge in that sense is the way Congressional Budget Office scores things?
It's a big challenge. I mean, it's something that whenever I was at OMB, we looked at it, but we would always come up with our own projections. I was the associate director for economic policy. I had a team of about 10 PhD economists and some others who were looking at efficiencies within government. And we had some different types of models we could look at and everything. We would do it from a dynamic perspective every time because we live in a dynamic world. We don't live in a static world. Behaviors change, incentives change, things of that nature. And so the CBO, I think, provides a good service in the sense that it gives us some numbers, but I wish they would be more realistic. In fact, I would argue if I was CBA director, which I don't know if I'll ever be one day, but if I was, why don't we look at a range, maybe more of a spectrum of here's the static results and here's the dynamic. Don't publish just one. And then that way you let the public decide. You let congressmen and women decide what they want to look at. I think that would be a better way.
Isn't it a fact that historically some of their estimates have been off by like trillions of dollars?
Yeah.
I mean, how can you have a yardstick which is that elastic?
Exactly. Yeah. You can't. You can't.
I've been trying to get the House and Senate budget committees just to hold hearings and insist that the Congressional Budget Office actually show us the algorithms and the formulas, all of which are right now a hidden secret black box.
Mm-hmm. Mm-hmm.
They're totally unaccountable for the process they use.
And I had the former CBO director, Douglas Holtz-Eakin, on my podcast, Let People Prosper Show, and we talked about all this stuff, and he was trying to move us more in that direction of dynamic forecasting and everything else. But it's difficult. When you have the belly of the beast within government and those bureaucrats who have been there for a long time, it's very difficult to change up some of those dynamics. But I hope that we can get to that point at some point, because if CBO is to provide any service at all, it's the Congressional Budget Office, meaning that they should be making as accurate a forecast as possible. And whenever we're looking at this from a budget or Senate Finance perspective, looking at appropriations, it's already difficult enough to write a budget, much less when you have bad numbers going into it.
Tell us all just for a minute, because it's such an important long-term issue, about your book on health reform.
Yes, so Empower Patients, 2 Doctors Cure for Healthcare is the name of the book. You can find it at Dorrance Publishing, Dorrance. We had the soft launch here recently. We're going to get more of that come out. But we really go into and break down the healthcare system, where the money is going, how it's tied up to so many rules and regulations, paperwork, and all these other things versus money going to actual care that's out there. And also the paper is at Americans for Tax Reform, Empower Patients initiative. We not only take on these huge costs of healthcare and how it's not helping people, where many people are really, Speaker, waiting in line. They're dying in line. Dying in queue is what we've called. Because if you're on Medicaid, for example, I live in Texas, near Austin, Texas, only a third of doctors across Texas take new Medicaid patients. And so there is becoming more and more of a longer line of people who are on Medicaid. At the same time that they're putting more people on Medicaid, we're seeing that they can't even get access to quality care. And so the big points here are that coverage does not equal care. And so we need to separate those two. We also argue that instead of having an employer-sponsored health insurance direct tax credit, it should go to the employee. The employee should have this account in a no-limit health savings account to where you could put as much money you want in there to use it for healthcare, to use it for health insurance, whatever you want, but don't force people to do that. We also think that block grants to states for Medicaid and SNAP and everything else, that should be a fixed amount. Maybe you increase it by inflation or some metric over time, but let's get away from this pay-as-you-go sort of system where the state manipulates things to spend more and then brings down more money from the federal government, meaning socializing those costs across the country. We should get back to a system of federalism where states can put in place their own Medicaid reforms. And the other big thing here, too, that we look at is finding more ways for the doctor-patient relationship, is getting rid of that third party. Because in most voluntary exchanges, when you go buy gas or you go buy a Snickers bar at a convenience store or whatever else it is, you pay for that voluntarily and make the transaction. In healthcare, we don't do that. That's one reason that it's jacked up the prices so much, and it's led us to have a lot of issues. I also just published a paper continuing with this on biotechnology. And are we going to hand biotech to Beijing? And this is with Americans for Tax Reform, because what we're doing is we're trying to say we need to lower drug prices. And the Trump administration has been out there advocating for this in a lot of ways. But we got to be careful, Speaker, where when we look at this, if we have the most favored nation sort of pricing and bring everybody down to the level of other countries, it also will likely dry up a lot of the R&D and innovation. Each new drug costs about $2 billion on average and takes about 10 years to come to the market. I think there's bigger reforms like FDA streamlining. A lot of this is because of the intellectual property, and I think that there's contract law and things of that nature need to take care of this, but we are waiting on these life-saving drugs and making it more expensive in the process. And so between bringing the doctor-patients back together and empowering patients, I really believe that we can have a better healthcare system that's more affordable and better quality in the process.
I think you're exactly in the right direction, and I encourage people to get your book and to realize that there's a lot of thought and a lot of ideas, and we have to dramatically improve the current system. It's too expensive. It slows down the rate of innovation, and it focuses on paying for sickness rather than paying for health. So I think you're onto a lot of big ideas. Vance, I want to thank you for joining me. I think this has been really informative. And I want to mention you do have a podcast called Let People Prosper, which our listeners can find at vanceginn.com or on Apple Podcasts. And we will have that link on our show page. So thank you very much for being with me.
Hey, thank you so much, Speaker. It's always a pleasure.
Thank you to my guest, Dr. Vance Ginn. You can get a link to his podcast, Let People Prosper, on our show page at newtsworld.com. Newt's World is produced by Gingrich 360 and iHeartMedia. Our executive producer is Garnsey Sloan. Our researcher is Rachel Peterson. The artwork for the show was created by Steve Pendley. Special thanks to the team at Gingrich 360. If you've been enjoying Newt's World, I hope you'll go to Apple Podcasts and both rate us with 5 stars and give us a review so others can learn what it's all about. Right now, listeners of Newt's World can sign up for my 3 free weekly columns at Gingrich360.com/newsletter. I'm Newt Gingrich. This is Newt's World.